Namaste, everyone. Thank you for being here with us on Karnamai Holistic Platform with Dr. Kiran Salunke. He is an MD doctor in Ayurveda from India. His specialization is Rasashastra. And Rasashastra is basically processing the herbal materials to make polyherbal drugs and processing of herbs into making them more active Ayurvedic natural drugs, not the allopathic, but the natural forms of herbal formulations, because Ayurveda is a lot about how you combine the herbs, in what quantity you combine the herbs actually increases, it can increase or decrease its potency. So a lot of herbal formulations you will see have different herbs in different combinations. And today, Dr. Salunke is going to speak to us about rheumatoid arthritis and what is the Ayurvedic cause of rheumatoid arthritis and what it means in modern medical terms. And then he will go more detailed into the Ayurvedic implications of this disease and how we could find some help with Ayurveda with rheumatoid arthritis and Ayurvedic healing techniques like Panchakarma and the other treatments and herbs. So thank you so much, Dr. Kiran Salunke. I'm very happy to have you here. So we can start your webinar. And just so anybody joined late, Dr. Salunke's microphone is having some problem. So I have put him on my phone and everybody was able to hear him on the speaker on my phone. So if you have any problem, please raise your hand if you can't hear it or anything like that. But so far, people said they were able to hear him on my phone speaker. So thank you, Dr. Salunke. I'll let you take off the webinar from here.
Yes, madam. Thank you very much. Good evening, everybody. Myself, Dr. Kiran Salunke, Professor in Department of Rasashastra and Bhashaj Kalpana, working right now in CPM Ayurvedic Medical College, Gonda, Uttar Pradesh, India. So let me start about the rheumatoid arthritis. The contents which having the part of modern medicine as well as Ayurveda and Ayurvedic treatment aspect, and what all the food things have to follow. Those things I am going to proceed. So see, most of you people know that what you mean by rheumatoid arthritis, and you might have gone through the internet, Google, about the disease of rheumatoid arthritis. I don't much tell about rheumatoid arthritis modern aspect. Okay, what is rheumatoid arthritis? What are the causative factors which causes the rheumatoid arthritis? And about the management, it is I'm not dealing much about the management in modern aspect. Okay, so as you know that rheumatoid arthritis is a chronic inflammatory disorder. Usually it comes under autoimmune disease. So around 20% of world population are suffering with rheumatoid arthritis right now. So the condition, it is not only causing the damage to the joints, it also causes major complication to skin, eyes, lungs, heart diseases. So you might have heard about rheumatic cardiac diseases. Okay, and even it causes problem to the blood vessels also. So as I earlier told that it is an autoimmune disease disorder, so which is mainly concerned with the immune system. So the our body is having leukocytes, which are called as T cells and B cells. So they are causing problem to our cells. So our own immune system is damaging our body cells, that is called as autoimmune diseases. Okay. Like the wear and tear which happens in the osteoarthritis because of osteoporosity, which causes osteoarthritis in the later ages. But rheumatoid arthritis, it causes much of the problem to the younger generation, okay, than the older generations. So the inflammation associated with rheumatoid arthritis is what can damage other part of the body as well. So already earlier I have mentioned that it causes problem to other parts of the body, other organs of the body, and makes the person disabled, suffer a lot. So symptoms, signs and symptoms is like tenderness, warmth of the joints, swollen joints, discoloration of joints, joint stiffness. When they get up in the early morning, there will be a joint stiffness, which makes them suffer a lot. So even that leads to fatigue, fever, loss of appetite, mental disturbances. So many things will happen with this rheumatoid arthritis. So you might have seen the photographs of rheumatoid arthritis cases. So management, I'm not criticizing the modern system of medicine. There some limitations. Okay, so they're prescribing NSAIDs, that is non-steroidal anti-inflammatory drugs. Those are called as COX inhibitors. COX is the neurotransmitter which causes which carries the pain sensation as well, and fever also. And they are advising steroids. Steroids are anti-inflammatory, so they have some limitations. So DMARDs, that is disease-modifying anti-rheumatoid arthritis drugs, biological therapies. So that is called cytokines and interleukin 1 inhibitor drugs they are advising. So later on, there will be a deformities with the joints. At the later, they are advising for the surgery. So coming to the Ayurvedic part, I'm starting with the basics of Ayurveda, little bit, not much, little bit, because if I straight away go to the disease part, you may not understanding the things properly. So little bit, I will start with Ayurveda. So first prime motto of Ayurveda is Swastasya Swastha Rakshanam. So shloka, I will make it into understand you people. Swastya means the health of a person. So as per the WHO says that prevention is better than cure. The same meaning it gives. Swastasya Swastha Rakshanam.
Dr. Salunke?
Swastasya means the health of a swastha, the healthy person. So prime motto is
Dr. Salunke?
prevent that disease before it happen. So what are the necessary precautions to be taken to become a healthy person? So
Dr. Salunke.
Yes, madam.
Are you moving your slides? Because your slide is still on the first page.
Still on the first page, madam.
Yeah, your slide is still on the first page. So I'm not sure that if yeah, now it's on that shloka, but it was still on that very first page so far. Yeah, now it's moving. Before it was not moving.
Now, madam?
Yeah, it's moving now. Yeah, it's on the first page.
So everybody, they can visible properly?
Yeah, it's on the first page right now. Yeah.
Now?
Yeah, it's on autoimmune disorder. It's moving.
Now it is signs and symptoms, no, madam?
Yeah, signs and symptoms, yeah.
Diagram?
Yeah.
Yeah.
Yeah, it's okay.
Okay,
now.
madam.
Yes, it's okay.
Okay. So far, what I have explained, it is much of about modern system of medicines. So let me start about the Ayurvedic part. Right now, I told motto of Ayurveda is to means preserve the health of a person to become, to prevent to become a diseased person. So that is called swasthasya swasthya rakshanam. So prevention is better than cure. So to become a healthy person, so one should follow the following things like having wholesome diet. Wholesome diet means according to the geographical area, according to the season. So what diet should have? So that is called wholesome diet. So because the person's prakriti will get changed. The prakriti of a person will get changed from person to person. So there will be a vata person, pitta person, kapha person. So those things I'm going to explain in future slides. So it is told that there are three upastambhas. Three upastambha, that those things are ahara, nidra, brahmacharya. Okay. So in that ahara means I am telling about wholesome diet. Nidra, that is proper sleep. Third one is abrahmacharya. Abrahmacharya means following good marital life. So those things are the pillars to make a person healthy, almost his lifespan. So before going to this slide, so let me brief about what you mean by vata, pitta, and kapha. So that is called tridosha theory. So vata, we can compare with the air. Here, see, in this part, vata is made up of the space and air, so which basically controls catabolic activity, initiation, motivation. These are all the functions and make the person alertness always. So these are all the basic functions of vata. And vata prakriti person, the person who is having the quality of so that is who is a very quick, very intellectual, and that particular person will be having Vishamagni. Vishamagni means the Agni means the digestive power, which is maybe sometime getting disturbed, sometime it may be getting corrected. So those things about the Agni I'm going to explain in the future slides. Pitta. So Pitta is compared with the fire. The functions like digestion, coloring to the skin, and some enzymatic actions like digestion, transformation, enzymatic actions. Those things are performed by the Pitta. So Pitta Prakriti person will be having Tikshnagni. So the increased digestive power. So coming to the Kapha, Kapha is mainly made up of liquid part, so which does the lubrication to the joints, maintains skin texture, strength, all these contribution given by the Kapha. The Kapha Prakriti person will be having Mandagni. So coming to the next part, that is Agni. Agni means here digestive power. So it will be not same with everybody. So it is going to change with the person who belongs to which Prakriti. Vata Prakriti will be having Vishamagni, as I told earlier. Pitta Prakriti person will be having Tikshnagni, and Kapha Prakriti person will be having Mandagni. So about Vishamagni, Mandagni, and Tikshnagni. So those things I'm going to explain right now. So before going to that one, what do you mean by Agni? So Agni is the digestive power. So everybody will be having, which converts a micro elements into a micro elements, so that the part our body cells will get the energy, which is being simplifying the food particle from macronutrients into micronutrients. So let me chant some shlokas so that I will explain it in a proper way. Saram metat chikitsaya param agnescha palanam asmad yatnena kartavyam vanyastu pratipalanam. See, the prime motto of a treatment of a physician is to maintain the digestive power of a person. So there may be a number of diseases. So the person will be get saved by only by a proper digestive power. So what happens in the rheumatoid arthritis is because of impairment of the digestive power. So first prime motto of a person is to maintain his digestive power. So that's why I told in earlier there are three upastambhas: wholesome diet, proper sleep, and having proper marital life. So first preference is being given to the ahar itself, the diet. So the importance of kayagni, that's why I told the doshas may cause number of diseases, but person will be get saved by only one thing, that is he should have a proper digestive power, so that no disease will cause his life problem. So coming to the type of agni which the person will have. Okay, it is depending on his body constitution, what prakriti belongs to and what agni is having. So there are three types of agnis. Manda agni. Manda agni means the agni which is diminished less, because earlier I told that kapha prakriti person is having a liquid part, and that liquid part which makes agni diminished. So because of the prakriti of a person, kapha prakriti person who is having manda agni always, so that kapha prakriti person should follow the diet which is suitable to his digestive power. Next, coming to the vishamagni. So that vishamagni is the agni which is not stable. Sometimes it may be bandagni, sometimes maybe it's a tikshnagni. So to explain agni, actually it requires a separate class. Okay, so that you can I will brief out. I will make you people to understand what is mandagni, what is vishamagni, and what is tikshnagni. So at the end, you can, if you have any doubts, you can get it clarified. So mandagni means diminished agni, the kapha prakriti person will have, and vishamagni will be the vata prakriti person will be having. That is, sometimes it may be diminished, sometimes it may be get increased. That is because of the influence of vata. Vata, already I told, it is morely made up of air. Tikshnagni, it is the agni the pitta prakriti person will be having, because earlier I told pitta is made up of agni. So agni, it makes the pitta prakriti person to have a tikshnagni. So the tikshnagni person, the pitta prakriti person, whatever the things he will eat and whatever the quantity of food he eats, he will get digested very quickly. But the mandagni person will not be having that capacity of digestive power. So I will not go through these shlokas. Mandagni, what the quality of mandagni person will be having. So that person will be unable to digest even small quantities. Earlier I mentioned small quantity of food also he unable to get digest. So we'll be having vomiting sensation. If he have more food, we'll be having vomiting sensation, and always complaining of anorexia. So not feeling hungry, not liking the food like that, and body aches. So if you have more food means that leads to indigestion, that leads to body aches, and that person will be having always over salivation from his mouth, and heaviness in the head, heaviness in the abdomen. So the point terms are there, so that I'm not going to tell about that chardi. Chardi means I have explained it for same slide. Tikshnagni person will be having a good digestive power. So whatever the quantity he eats, he will get digested. And number of times he will eat, but it will get digested. So very fast, easy digestion of heavy quantity of food. It is considered by many scholars as a sign of good health. So earlier I told Agni is the prime factor which makes the man healthy. So coming to the Vishamagni person will be having irregular digestion capacity. Sometimes he may be having good digestive power, sometimes he will be having a diminished digestive power. So because of this, he is having flatulence problem. So people will be complaining of constipation, irritable bowel syndrome, like that, distended abdomen, because collection of air, because of not proper digestion of food. So because of that, there will be a distension of abdomen. Constipation also causes distension of abdomen, pain abdomen, heaviness of the abdomen. So he will not pass the defecation properly. Always with the pain, he will pass the defecation. Sometimes he is complaining of diarrhea. So like these are all the complaints or the kind of symptoms the Vishamagni person will be having. So what is the prime importance to be given to the Jataragni, that is digestive power, to maintain it? It's always will be in the intact. So what all things we have to follow? See, there are three conditions may happen because of impaired digestive power. That is called amajirna. So I already told that the Kapha Prakriti person will be having Manda Agni. So that also called as ama ajirna. That is called a nauseatic sensation. So because the involvement of kapha makes the agni amajirna. So that such persons will be complaining of emesis or whatever the quantity of food they will have it, they will get a vomiting sensation. So the such persons should have the little quantity of food, or they should go for fasting. So not oftenly, whenever they are feeling nauseatic sensation, they can go for fasting. So that is the only remedy for that one. So next, Vidagdha Jirna. Vidagdha Jirna means people will be complaining of sore belching. So after having food, after when the digestion starts, when the enzymatic action starts, they are complaining of sore belching. So there, the pitta involvement will be there. So for such people's, them it is advised for fasting. So by that only it will get it corrected. Vistabda Jirna means there will be a distension of abdomen. So there, the involvement of vata will be there. So coming back to the three different types of the Agni, depending on the Prakriti of a person. So how to control that impaired Agni? Starting with Vishamagni, Vata. So to control Vata, so what we have to do is, so this is the right treatment is to advise the person to go for medicated ghee. So how it should be taken? It should be added with the food. The medicated ghee or a simple ghee, you can add with the food. It can be taken. So that what happens, the air which is inside, which has been accumulated in the intestine, will be getting corrected. So that by that method, Vishamagni will be get corrected. So coming to the Tikshnagni, a person is having the more powerful digestive power. Whatever the things he is taking, he will be getting digested. So there is a disease called Pasmaka Roga. Pasmaka Roga is the kind of a disease. The person will be eating frequently. So then also he is feeling hungry. So same thing will be happening in diabetic mellitus, where the person will be having polydipsia. polyuria and polyphagia. Polyphagia is the condition where the person is having more decreased digestive power, but it is not a proper digestive power where the person is having in diabetic mellitus. But Tishnagni is the condition in the person who belongs to Pitta Prakriti. So how to control that one? So the person should take rich dietary fiber foods. So rich dietary fiber food means that fiber food will be having rich of polysaccharides. Polysaccharides means it's a kind of a carbohydrate which will take more time to get digest. So like barley, wheat, jawar. So those such kind of food is being advised to Tishnagni person. So Mandagni, coming to Mandagni, so already I explained Mandagni person will be having very much diminished digestive power. So small quantity food itself causes a problem for that person. So how do we have to try to specify or to nullify that problem is, so drying of kapha. Drying of kapha means you should go for fasting, exercise. So doing all kind of body activities. The person, kapha person already is having diminished Agni. If he is going for sedentary life, again the condition will be getting worse. So such people will be going for fasting. So by the fasting and by exercise, what happens? Whatever the glucose or carbohydrate is being accumulated or fat is being accumulated, that will be getting exhausted. So that person will be feeling hungry. So the person who is doing exercise, body activities regularly will be having good kind of or good functioning of digestive power. So coming this rheumatoid arthritis is being called as Amavata. Okay, understand? Amavata. See, Ama is the condition which is going to form when the person is having impaired digestive fire. So digestive fire not properly functioning, so that leads to formation of undigested food. So undigested food, we are calling it as ama. So due to the impairment of digestive power, the food that which is being consumed is either fermented. Fermented means it's a condition not being properly digested. It may get digested at the later stage, or it may not get digested. So again, I'm telling the importance of ahara and importance of digestive power. When you're having good digestive power, you can have the food, the quantity of food which you can get digest. That is your digestive power. So people, what they will do, so they will be having food in the morning as a breakfast, lunch and dinner. So if they don't feeling hungry also, they are taking the food. So that is the problem. So nowadays the people are having that if they don't feel hungry, they will eat. So by eating that, they will get energy. That is not the right method, because when you feel hungry, then only you have to have the food. So it may be fermented or putrefied, and it is gradually accumulated all over the body. So when you're not feeling hungry, you are eating the food, it is not being getting digested. That is going to form a undigested food, or later it may become a cytotoxin. So you can compare the ama with a cytotoxin. So that cytotoxin is being getting circulated all over the body. That is called as ama. So again, see, Amavata is the problem is being caused by the diminished digestive power. That is because of eating the food not in a proper way. So that is going to form ama. So then coming to Amavata. So don't get confusion. Ama is undigested food, and that particular ama is being carried to the all over the body. That requires vata. So understanding this one into deep. So it is a bit difficult for you people. So I will make it clear. Ama is that which is being formed because of impaired digestive power. So that cytotoxin is being formed. That cytotoxin is being carried by the vata. So that is makes ama vata, rheumatoid arthritis. So I will make it further simple. See, we'll go through the slide which showing that. I will make it clear. Okay. What happens? Already I told food and your bodily activity and your mental activity. So what all these three things are the contributors to make the digestive power diminished. So what I told, so eating heavy food, not feeling hungry, you're eating heavy food, eating oily food, and eating unwholesome food. So it may be, it is not as per your prakriti, as per your digestive power, it may be it not, it is not matching with your digestive power, it is not matching with your prakriti. So then it makes unwholesome food. Understood? Next, activity. So leading a sedentary life, not at all having any kind of bodily activity, always following sedentary life and day sleep. See, people they are having the habit of watching late night, watching the TV late night. They are always with electronic gadgets, so that they will sleep in the day. So that sleeping in the day make the person having a diminished digestive power. So mental activity, someone who is always sorrow and having a sad and expressing angry towards other people. So all these things makes what happens impairment of digestive power. So impairment of digestive power, that is unable to digest your food. So then the formation of ama. So already I told that is the undigested food or a toxin which is been going to form. So all of a sudden you are not getting that ama vata later by 6 months or 1 year. So you're following same kind of activities what I told in the in the way of food activity, mental activity. These activities, if you are following continuously, so that makes the ama to get formed. So that ama or that is the toxin, cytotoxin, which is going to form and it is being getting circulated all over the body, and later stage it is going to accumulate in the joints. So such condition makes the amavata. So that condition may be inflammation of the joints, redness of the joints, or what I have shown in the diagram. See, the joints will be getting swollen and redness, tenderness, unable to flex it. So such kind of problems get arises. The person one who follows the regiments which are not suitable to his prakriti. So I'm going back again. So these are all the etiological factors which causes amavata. So just in this sloka they have told viruddha ahara, that is not having unwholesome, having unwholesome food, that is called viruddha ahara. Viruddha ahara means someone is having a habit of taking the fish along with the milk or having fish along with the curd. So that is viruddha ahara. Someone is having the habit of adding the milk to the curd. So someone is having the habit of mixing ghee with honey. So that is viruddha ahara. There are a number of viruddha aharas are there. So these are all the examples I am putting here. So that person who is having viruddha ahara and poor digestion. So already explained
person is having poor digestion and repeatedly following, eating food, not even having proper digestion, not feeling hungry, then also they will be having food to live with. So sedentary life, not having physical activity, that also makes diminished digestive power. So because of this, what happens? The ama is going to form, or there will be a impairment in the metabolism. So we have two types of metabolism: catabolism and anabolism. So I'm talking about catabolism. Catabolism means I told macro elements to micro elements. So conversion, that is called as catabolism, breaking down the food particles, macro food particles like carbohydrates, protein, fat. So we have catabolic activity. So that what happens, that will be getting diminished because of diminished digestive power. So because of this, what happens, the vata will be carrying the cytotoxins, toxins towards cells, towards the joints. So there what happens, the toxins are going to be accumulate. So later on, the conditions like swelling, tenderness, redness, pain, unable to move the joints, these kind of symptoms will be getting appear. So complications in the later stage, what are the complications? Like anorexia, not feeling hungry properly, heaviness in the body. So there will be a lethargic fatigue. The person who is having bad digestive power will be having mouth, bad smell will be coming out of his mouth, and polyuria. So when you are having more of fat, definitely will be having polyuria. So then heaviness in the abdomen, colicky pain. So these are the conditions will be come across in the Amavata or rheumatoid arthritis patient. So there will be an involvement of doshas. It is not hard and fast rule that Amavata only Kapha and Vata involvement will be there. There will be involvement of Pitta. So Pitta involvement is there means person will be having burning sensation and discoloration, pricking pain in the Vata condition. So you can compare these two joints where exactly the one joint is having swelling and redness. So that means there will be a Pitta involvement. So coming to the treatment part, the conditions, it depends on the condition. See, someone is having severity. So the person who is having severe kind of rheumatoid arthritis or Amavata, so in that person, all of a sudden we are not advising for medicines. So the digestive power is so much getting impaired that if you give a medicine, that medicine may be not get digest or may not be get act properly. So much the digestive power is so much getting disturbed that even a medicine can cause the problem. So in that one, so initially we are advising Langana. So Langana means not taking food at all. So fasting for 6 hours, fasting for 10 hours. So when you're advising fasting means we have to see the strength of a person. The person is not having strength. If you're advising for fasting means, so further, so when you're doing fasting, it deplete your fat. So we have to see when you're advising or when you're doing the fasting means you have to assess your strength. Okay, it is depending on your prakriti also. A Pitta prakriti person cannot tolerate Langana because he is having Tikshna Agni. If you're advising Langana means further depletion of the fat that may leads to fatigue or he may get fainting. So Langana means the condition. It depends on the condition to whom do we have to advise Langana. So here, in treatment part, it starts with the Langana, next is Svedana. So I have explained here, Langana, fasting, taking light food. It may be a light food, or you may be totally. There should not be any kind of food. Some people will be on the by taking only hot water. They are doing fasting. So that also be possible, no problem. Or if you are not taking any food, means that is also fasting. So that is depending on your digestive power. Next comes that treatment is Svedana. Svedana means fermentation. Fermentation, it may be dry or it may be wet. So in this one, in Amavata, we are advising dry and hot fermentation. In future slides, we will come to know. Next is Deepana. Deepana is lighting the lamp. Lighting the lamp, that is Deepana. So Deepana means the drugs which are having the property of increasing the digestive power, that is called appetizer, carminative. So here in this Amavata condition, or in rheumatoid arthritis, we are advising bitter and pungent drugs, so which are having bitter taste. So usually we are advising neem leaf. So there are other drugs are there which are having a bitter taste. Next, we are going for Virechana. See, these treatments are not been, we are going to do at the same time. It is a condition where exactly first we are doing with the Langana, next we are coming to Svedana, next we are giving Deepana, next Virechana. See how we are putting a fire. When you want to get a fire, you are starting with a lighter woods, so that which can get the fire early. So next you are going for a larger woods. So like that. So when you want to increase the digestive power, so we have to initially we start with the Langana, next coming to the Svedana, Deepana, and Virechana. Virechana means so the whatever the toxins are being accumulated in the body, it is being taken out through the procedure called Virechana. So here I told Svedana. So Svedana, hot and dry fermentation. So there is a small video is there. I'm going to play now, so people can come to know that. So what do you mean by that? So this Valuka Sveda is nothing but the procedure is being done by using Valuka. Valuka means sand. Valu or Valu. Okay. Is it visible to everybody?
Your screen is black now, like it's grayed out.
Madam, I'm sharing videos. So what new share have to click?
Can you play the video and we see if we can see it or not? Is it playing right now?
Yeah, it is playing, madam.
No, we cannot see.
Let me.
Also, because your audio is not audible, right? We are hearing you through my phone.
Just madam, just a minute. Now it is visible, madam.
No, it's not.
Okay, I will continue the slide, madam.
No problem.
The slides are visible, madam.
Yeah, slides are visible.
Okay. Thing is Valuka Sveda. So earlier I have mentioned that Svedana means the fermentation. There are two types of fermentation. One is wet fermentation and dry fermentation. In rheumatoid arthritis, we are going for a dry fermentation. Dry fermentation means that is Valuka Sveda. Valuka means sand. So I will explain. Sand will be taken, which should be dry. It is to be taken over a iron pan. It has to be made into little hot. Okay. So after that, it has to be taken in a cloth, and made into a poultice form. Then it has to be placed over iron pan, make it hot, and you apply over the affected parts, the swollen parts, so that what happens, whatever the stiffness you are having, so those things will be getting reduces. So if possible, I will show the video at the later end. Next, Upanaha Sveda. Upanaha Sveda means the poultice, the application of medicated drug over the affected parts, the swollen parts, so that the applied paste of medicated paste will reduce the swelling and will reduce the redness. So in your home, you can prepare simple the paste, that bandages, you can say bandaging. So by using mustard seeds, that is called as Sashapa bija, or mustard seeds or sesamum seeds. You can take little bit of salt. So mix all the ingredients together, make into paste, and apply over the affected parts. So it should be applied for 30 to 40 minutes. Then it has to be washed off by using hot water. So there are some recommended churnas, that is Upanaha Svedita churnas are there. That is called Gruhadumadi Lepa. Gruhadumadi Lepa means, Gruhaduma means the carbon which is adhering to the chimneys. So that carbon also you can use. By adding the hot water, you can make it to paste and apply over the affected part. So Kottam Chukadi Lepa is also there. It is available in Kottakkal pharmacy. Balagulichadi Lepa is there. There are some drugs being added and made into paste. So line of treatment I have explained earlier. So that first it is starting with the apatarpana. Apatarpana means the procedure which reduces the body weight. So if you are on the fasting, obviously it will reduce your weight, because your cells will be utilizing your body fats, so that person will become lean. So here apatarpana means already there is a diminished digestive power. So by that, what happens, your body has been produced the toxins which is not been getting digested. To digest those toxins, so we are going for the procedure called apatarpana, so which reduces the body weight. That is langana, doing exercise or exposing to the sunlight or doing some hard work. Those are all called as apatarpana chikitsa. So depending on the severity, we are doing, we are advising carbonative. So person is having a little bit of digestive power, means to increase that digestive power, we are advising carbonative drugs. So simple pepper, we are advising ajwain, we are advising. So hot water is also one of the best. This thing is to which increase the digestive power. So elimination. So if the disease is been in such a condition, it has, means the person is suffering with the disease with by 3 years, 4 years, 5 years, means already toxins are so deeply has been went inside, so that it is never possible to get treated by a simple medicine. For such people, we are advising elimination therapy, that is called Panchakarma. So by advising Virechana, Basti, Vamana, so those things will be advised. So Svedana means fermentation, already I explained. Ruksha Sveda we are advising in this Amavata condition or in rheumatoid arthritis. Rasayana chikitsa means again the person who is already having so much wear and tear, there is a damage to the normal cells to make it to regain that energy back after taking out all the toxins from the body. After having proper digestive power, we are going for Rasayana chikitsa, that is called immunomodulators, and advising proper pathya to the person. So, see, these, what the things so far I have explained, it is about the Agni. What do you mean by Agni? What are the types of Agni? And which Prakriti person is having which Agni? And what do you mean by Ama? What do you mean by Amavata? How it is going to happen? What are the etiological factors? What is the pathogenesis? Everything I have explained. So you will get the things in internet also. You can see the things. But thing is, coming to the preparation of food which is suitable for rheumatoid arthritis person, and which are the kinds of foodstuffs he has to follow. Those things I'm going to explain right now. So these things I'm given more stress towards the food particles. Okay, so we have Shaka Varga. Shaka Varga means vegetable parts. So we have leafy vegetables, fruit vegetables, rhizomes. See, which are all suitable for which Prakriti person, which is not suitable for Amavata. Those things I have stress over here. Okay, so we have Shaka Varga. Shaka Varga means vegetables. Shuka Dhanya. Shuka Dhanya means we have monocotyledons. Okay, we have pulses, cereals. So like rice, wheat, barley, jawar, millets, ragi, so etc. These things are being called as Shukadhanya. Shimbi Dhanya means dicotyledons, which is having two slits. Okay, which when you slits, the seeds will be split into two. So there we have pills, legumes, cereals. Those things are there, which are all suitable for Amavata or not suitable for Amavata. Those things I am going to explain. So we know that cereals are like barley, wheat, oats, jawar. Those things comes under cereals. The thing is, when you choose a cereals, so the cereals should not be new one. So I'm repeating, when you are selecting for barley, wheat, oats, in India, so the people are using the barley, wheat, rice, ragi, everything, which are of at least 1 year old. So that particular foodstuffs are very good, which are very much old one, at least 1 year old. Purana Shali means old rice. Purana Goduma, that is wheat. So Yava, we are calling barley as a Yava. That is all should be taken in Purana. Purana means at least 1 year old things has to be taken. So barley, it is rich of dietary fiber, which is very good. The food stuff which is been advised for Amavata patient, that is rheumatoid arthritis patient. I'm repeating. So these things when you're choosing, so it should be a old one, at least 1 year old. So we have pulses. Okay, so see, I'm telling all the pulses are not good for Amavata. Some of the pulses. So like we are having this one Rajma, that is kidney beans, which is not at all advisable for Amavata patient or rheumatoid arthritis patient, because it is of rich protein. So Rajma, if you have, definitely it is going to increase your ama condition, or the person who is having diminished digestive power, we should not take Rajma. So that is not advisable. So millets. So millets, why it is been advised in obesity, in Amavata condition because it is having rich of dietary fibers. So this, what happens, this makes, this will reduce your body fat, it will reduce the cytotoxins in your body. So we can prepare different kind of foodstuffs, like if you fry it, it will become very light. You can make it to rava-like form. You can go for khichdis. You can prepare your sweet items. You can prepare. Okay. In the future slides, I have told, I have mentioned. So how we can make the different kind of foodstuffs out of millets, out of cereals, out of pulses. Okay. So there are some vegetables which is being advised. So in that one, first one is bitter gourd. Okay, Karela, bitter gourd. So it is best advised because it is having a bitter taste. No, so many people they don't like bitter gourd because bitter gourd is because of its bitterness. People, so many people they will avoid this vegetable. So which controls pitta because of bitterness. Because of bitterness, it also controls kapha, and it will purifies the blood because of its quality. And it is best advised in diabetes and good appetizer. It will increase the digestive power. So parval, so that is pointed gourd. So we are calling it as tondekai in Kannada. So that is best advised in rheumatoid arthritis. You can make different kind of, as per your taste, you can add the other things like pepper, which are carbonated, which can increase your digestive power, and you can make different kind of salads. So thing is, when you're preparing the things, you should not go for more of unsaturated fats like this one dalda is there, palm oil is there. Should not use. Okay, so you prepare in such a way that it should get digest easily. So Shobhanjana Phala, so that is drumstick. So drumstick best advised in rheumatoid arthritis because of its quality, because of its having the capacity to increase the digestive power. So it is been best advised. Runta, that is brinjal. See brinjal. So when you're choosing a tender one, that is best advised in that is in rheumatoid arthritis. That is Amavata, good for Kapha-Vata diseases. And when you're going for selection of brinjal, so always you go for tender one. So tender one, if it is baked on fire, decreases kapha. If you are again the same brinjal, if you are processing it with oil and salt, it becomes guru. Guru means it is heavy for digestion. It is snigdha, it is having rich oil. So that what happens, the condition may worsen of rheumatoid arthritis, that is Amavata. At the same time, if you are boiling, if you are processing it with a dry fire, so what happens, it will reduce the condition. So this is best advised. So again, watermelon is not been advised for Amavata condition. One more, this one vegetable, that is small bitter gourd. It is very good selection for the selection of vegetable for rheumatoid arthritis. So Suranakanda, elephant yam. So that is best advised for such condition of rheumatoid arthritis. And so if you are using vinegar, so you can prepare vinegar out of this elephant yam. So because it is a rhizome which is containing rich of carbohydrate. So of course you know that for the preparation of vinegar they are using carbohydrates. So that by that we'll get acetic acid. Vinegar will have rich of acetic acid. So don't prefer that it has been synthetic one. Don't prefer that one. you can prepare out of elephant yan. I will explain in future slides. So when you are selecting mulaka, that is radish, so should not go for big radish or elongated radish. So the smaller one is advisable. Okay, you can make khichdi, you can make different kind of preparations out of small radish. Okay, so don't go for bigger and larger one radish. So carrot is, it is advisable in rheumatoid arthritis. It is good. Thing is, it depends on the preparation, what kind of preparation you're doing. So coming to other food preparations, that is called krutana. Krutana means food preparation. Preparing food out of millets and cereals. So here anna means the preparation of the thing out of the rice. Okay, so what happens when you are purchasing rice which is of old one, so before it is going to be prepared, it has to be soaked. It should be soaked in the water so that little bit it will get swollen. So that rice has to be boiled in 4 times or 6 times water. So if you take 1 glass of rice means you can add 6 glasses of water. So make it a little bit semi-solid. Okay, so that it is very easy to get digest, and it should have it soon after preparation. It should not be kept aside, or it should not be kept aside for 6 hours, 7 hours, or should not be kept in the fridge. So that what happens, the quality is getting deteriorate, and that rice it become heavy for digestion. Okay, if you are soon after preparation, if you have it, it is lighter for digestion. So you can see that preparation of what you say dal which is being boiled in the 4 times 5 times water. So dal preparation. Okay. So here in this one I prefer green gram. So green gram, so best advised in Amavata. So splitted one you can use whole green gram you can use. So by adding salt and ginger or little bit of asafoetida, means according to the taste you can add it. So that is called soup. Okay, soup prepared out of green gram. So next one, if you are not getting green gram means you can go for horse gram also. Okay, kulatta, that is called kulatta. Horse gram is also advisable. The thing is, one should have a good appetite to get digest the horse gram. So in this one, when you are preparing, so husked and dehusked, the covering if you take, that will be dehusked, that is green gram. So in that one, if you're preparing with a dehusked soup, so dehusked if you green gram if you are using, that is very light for digestion. So it will get digest very quickly. By the same time, if you are using husked one, so it is little bit heavy for the digestion. It will not get digest in quicker session. So next, when you're preparing bread, so preparing bread, if you are preparing, the bread out of wheat flour, which is heavy. Okay, again, the wheat, if you're using of older one, 1 year, 2 year old wheat, so then it is lighter. Okay, so usually the wheat flour when compared with the barley bread, so barley is more lighter. Okay, so anybody, if you want to reduce your body weight, can go for barley, which is best advised in obesity. So it is also best advised in rheumatoid arthritis also. So bread made up of chanaka. Chanaka means Bengal gram. So that is also best advised. So when you are preparing soup out of vegetables, so here some preparations. So green vegetables, so water according to the digestive power. If you have less digestive power means you can add more water. So more water you can add, you can boil it properly so that the vegetables will be getting boiled properly, will be very soft, very easy to get digest. That one you can add asafoetida, cumin seeds. You can add store materials like unripened mango juice. Also, it is preferable. You can add so as per your taste. Next, rock salt. Saindava lavana we are telling. Rock salt. It is best carbonative. It will increase your body. The digestive power. So that is will help to reduce the condition of amavata. So, see, one more preparation is there. The preparation of kanji. We are telling it kanji. That is acidic preparation. So, acidic preparation. Why I'm telling here is. So I'm sorry, I'm unable to show the videos. So this preparation, which is been prepared, and after the preparation, that liquid you can pour over your affected parts, affected joints, so that this preparation will reduce the inflammation by half an hour, or you will be free from stiffness, you will be free from pain. Any intense pain will be getting reduced by this preparation. So in this one, we have to take one part of rice. We have to take so to that we have to add 14 parts of water. So that you have to boil it so that the rice part should very soft. So then add few pieces of radish slices. You can add mustard seeds. You can add asafoetida and till seed. That is sesame seeds. You add. Then fill in the earthen pot. So after that, you have to seal it properly. So seal it properly, and it should not be touched. It should be keep aside for 7 days. After 7 days, if you open it, you will get an acidic smell. The supernet water will be taken, and which is being taken, and it is being poured over your affected part. So how much quantity of water you will take for the pouring over the affected part? So that much quantity of water is to be added back to that preparation and make it little bit hot, so that it will be stable for a week or 10 days. So that preparation, if you prepare, so that will be a good solution for your problems. So I'm unable to show the videos. So preparation of mango vinegar. So I told don't go for synthetic vinegars. So you can prepare yourself in your home. It is very easy. So what we have to do is take unripened mangoes, take the pulp and made into paste. And to that paste, you can add mustard seeds, salt, and a little bit of asafoetida. So make into paste. So that paste has to be applied inner part of a earthen pot. Or if you don't have earthen pot, you can take the glass container. You can take wood container. So you have to apply inside the container. Then you add water. How much quantity of water you require, that much quantity of water you can add. And again, you have to keep it for, seal it, again keep it for 7 days. So that water you can take as a carbonative. That will increase your appetite, and it reduces, when you have good appetite means your the inflammatory condition will get reduced. So preparation of buttermilk, you know that. So people, they will take curd and they will add water. So how much water you have to add? So when you are doing churning, whether we have to take the fat or we have to leave the fat or we have to have it along with the fat. So those we have different kind of buttermilk preparation. So takra preparation. Takra means here buttermilk. So 1 cup of sour curd and add 4 glasses of water and churn well. So churning in such a condition that the fat is going to be released. The fat is being collected in the upper part. You have to take out the fat part. So fat part has been taken to that buttermilk. You add salt, that is saindava lavana, rock salt you have to add. You can add pepper, You can add ajwain, cumin seeds. Okay, so you prepare the takra in such a way that it should increase your appetite. Okay, and after the preparation of takra, after taking out the fat, again you can add little water so that it will get digested properly. So same thing, if you take one part of curd, if you add sugar and churned properly, that is called as gola. Gola is nothing but your lassi. Okay, so that is not advisable for rheumatoid arthritis patients. So next comes madita. So madita is curd churned, well taken. So butter will be taken. So this is also advisable for rheumatoid arthritis. Udasvita is another preparation. So sorry, I am not get the English word for these things. So just we can note the preparations. Okay. Udasvita is the preparation wherein we are taking one part of curd and we are adding half part of water and butter is not taken. That is kafakaraka. The person who is very lean, who is not having strength. So for such person, this is advisable, not for rheumatoid arthritis patients. So Upanaha means already I told the poultice application of paste over the affected part. So here you can prepare this paste. Then you can prepare and you can no, you should not prepare and should not preserve it. So whenever you require, you can prepare instantly and go for the application. So tamarind leaf will be taken. So that we have to add rock salt, that is called Saindavalavana, and Gomutra Arka. So Gomutra, otherwise if you don't get it, you can add water also. So paste has to be prepared out of that and it has to be applied over the affected part. So if you are not getting, Gomutra, you can add kanji also, that is sour vinegar. So earlier I explained, no, sour vinegar also can be added, this one. So next preparation of vinegar. So from the rhizome I told, elephant yam, from that you can prepare vinegar. So preparation out from rhizomes like a radish, elephant yam. You can add mustard seeds.
Dr. Salunke, sorry,
Yes, ma'am.
I'm interrupting you in between. You said to add sour vinegar in the last slide with tamarind leaf. Which is that
Yes, ma'am.
slide? Where is that sour vinegar that you asked to add with the tamarind leaf juice?
Yeah. So earlier I explained this one.
Oh, sour kanji.
Preparation.
Sour kanji preparation.
Yeah.
Okay.
Yeah.
Okay.
So if you don't get Gomutra,
Okay.
then
That's
you can
a
go
good
for
replacement.
this
Okay.
preparation.
Okay.
Yeah. Already explained this one. Preparation of vinegar by taking elephant yam or radish, because radish one, your small radish, you can go for a small radish. So because that will be having the property of increasing the digestive power. See, here I am advising. So food stuff preparations explained. There are so many preparations are there. It requires another class for that preparation. On your demand, I can prepare one more class for this one, food preparation. So coming to Rasayana. So Rasayana is the preparations which is been advised in a condition where the person is having less immunity. So in Amavata, should not initially advise Rasayana because already they are having less digestive power. So that first initially we have to start with Langana. Langana means fasting. After proper digestive power, then you go for some cognitive drugs. If the person is having Amavata since long time, so the toxins are in the deeper cells then we have to go for Shodhana, that is elimination therapy. After doing all these things, the person will be having less strength. To regain the strength to back and make the person strong so that he can fight against the diseases. So we are advising Rasayana. So that is immunomodulatory preparations are there. See, simple way you can say that having ghee is also best Rasayana. Having a jaggery, that is also simple Rasayana. Okay, but thing is, when you're having, if you're going for Rasayana therapy, that is immunomodulatory therapy, should have good appetite. So for everybody, the digestive power is the ultimate. So when who have good appetite will be having good health. So one should maintain his digestive power properly. For that, you have to select your foodstuffs so that which can match your, which cope up with your digestive power. So in this, we have Pallataka Rasayana, Lashana Rasayana. Lashana means your garlic. So there is a preparation called Lashana Rasayana, Chitrakadi Rasayana, and Vacha Rasayana. So these are all the Rasayanas which has been advised for the arm of the patient, but he should have a good appetite. After all the line of treatment, after proper maintaining of digestive power, then we are advising person. So this is my presentation. So any kind of queries, please let me know. Yes, madam.
This was good. I think this was one of the most elaborately presented presentation. There was a lot of information, and
Yes.
there was a lot about different preparations from herbs and Ayurvedic herbs that people can make simply at home for both external and internal healing. I was not expecting there'll be so much information. So thank you so much for sharing a lot of good information for rheumatoid arthritis. This is really, and it's very simple. Like this is like stuff that we use at home, and we can just quickly, you make use of these herbs and all. Apart from that, you also shared what medical treatments are available in Ayurveda from Panchakarma and Shodhana and Vamana, and also that was also very highly beneficial for all of us to know if we want to consult Ayurvedic practitioner for undergoing any of these Panchakarma therapies. Because these should always be done under guidance of a Panchakarma doctor, right?
Yes, madam. Thank you.
Yeah, so Panchakarma treatment, I have gone through it, so I know it should always be done under the care of a doctor, should not be practiced alone. The remaining homely remedies are pretty much like things we use at home, so they are okay, but always use any like herbal formulations from store or undergoing any treatment, always consult an Ayurveda doctor. And this is definitely more for information purpose. Anybody else has any questions for Dr. Kiran Salunke on rheumatoid arthritis? Or how did they find the presentation overall? Any comments or anything? Mel, Themali, any questions, any comments? How you guys found the presentation overall?
Well, I found it very informative. It was very detailed, and I appreciate the time that the doctor spent with us. So thank you very much.
That's good.
Found it very interesting.
That's nice. Good to hear. Any questions from your side for Dr. Salunke? Thank you, Timali. Timali, are you from India or are you from Canada?
I'm from Sri Lanka.
Okay, you're from Sri Lanka. Okay. Good to know that people are joining from different parts of the globe. It's really nice to have you guys here. And I think that Dr. Salunke's presentation was just so elaborate that people don't have any questions. So none of you have a question. Melanie, do you have a question? Any question or any suggestion for next topic? Dr. Salunke will be back.
What about chronic back pain?
Chronic back pain. You have a chronic back pain too?
Yeah, it's chronic, but it does have its times where it's totally gone, and I think, oh, what happened? It's great. I'm like normal, but it's come back.
Yeah, I
So,
have it too. So it takes some time for that to go. Mine went away completely with Panchakarma massages. I didn't feel anything for over a month after.
yeah.
But then it came back. But
Yeah.
I'm also at fault because I don't take the Ayurvedic medicines regularly in a proper way. My mom even says that to me, that I'm not following it. So now these days I'm taking the medicines very regularly. In the past 4 or 5 days, I've started doing it. And I felt some difference, at least in certain parts, like, because I had back pain, it would also give me some gastric issues. So I saw the gastric issues actually came down with the Ayurvedic medicines. But I'm taking it like religiously now because like my mom would always say that you're not following anything. You don't want to take allopathic medicines properly. You take it sometime and then you're not Ayurveda, you keep forgetting, you don't take it. So you have to really follow the whole course religiously to do it, because Ayurveda obviously will take longer time to fully heal you.
Sure.
So,
Yeah.
so I'm doing it because I got the medicine like 2 months ago and it's still kept for my back pain. So we have to sort of follow the regimen and the course of the medicines and everything as the doctor says. So that's one thing that is important. But my pain actually went away completely when I got Ayurvedic hot oil massages and steam, and they would pour like a bed of oil on my lower back only, like hot oil, and cover that area. And that was also very relieving at that time. These are all medicated oil. That is why I was so surprised that my back pain was totally gone after that. For like, I didn't feel it for over a month or so, and then it started coming back.
Yeah,
So,
well, they relieved a lot of pressure there.
yeah, they
Loosened
did.
it.
But then you have to sort of continue, right? Like you have to probably find out other ways, like taking the Ayurvedic medicines or finding right yoga exercises to continue healing that place and not let it
Sure.
fall back. But I didn't follow through that. That was my mistake. And I think that I need to probably have a Ayurveda doctor and a yoga doctor combined into one to teach me everything, to not just do a panchkarma, but also give me a full lifestyle management coaching, that okay, you have to do this now to maintain it. Sometimes I feel, Dr. Salunke, that some Ayurveda doctors today, like I'm just being honest, that I feel that some of the Ayurveda doctors today are more so into selling treatments, which is like allopathy. So it makes them very same as allopathic doctors. They're not the same as the rishis and acharyas, who really would care for the patient to the point that they would call them, they will check with them, they will ask them how they are improving. And Ayurveda was also about preventing. It was not just about selling a treatment or selling a panchkarma treatment, but also how you could maintain that face afterwards, how can you keep yourself healthy. So Ayurveda was also about, that it was also about life coaching. It was not just about giving a Panchakarma treatment and selling medicine and a Panchakarma medicine, but also sort of combining a life coaching aspect to it, because Ayurveda is such a pure wisdom of sages.
Yes, definitely.
So I feel that today Ayurvedic doctors are sort of also lost in terms of just wanting to give you Panchkarma, and all the treatments and the medicines, but they don't want to guide you into the lifestyle coaching management. Okay, now you have to do these exercises to maintain it. Make sure you do this, or even during the treatment they ask you if you started doing it, or after the treatment it's not the same compassionate, empathetic way. Though the treatments totally work. I agree with that, because I felt a difference when I did Basti and Panchkarma, uh, and massages especially. But I felt that there was a lack of the Dincharya coaching, because Ayurveda is a lot about your Dincharya also, right?
Tucharya is very important.
So there was not that coaching aspect, and I see it is missing in Ayurveda doctors today. It is more like allopathy. It's more like a business today. I'm sorry to say.
Just I will interrupt you. Thing is, the doctor one who follows the rituals himself first, then he can advise the patients. Right now, madam?
That's true. That's true. Actually, you're very right, because there was a doctor who came on our platform before from South India only. He has a hospital in South India. He has his own hospital. And I've seen how his Panchkarma hospital is. It's almost like an ashram. So when people come there, he makes them follow the whole regimen of yoga, so like the whole, it's not just giving a Panchkarma or selling a treatment, but it is about totally making their entire life change into a different reformed life, so that the treatment actually affects you long term in a transformation. Your inner, there is a outer inner transformation along with treatment, because medical treatment can help you shortly unless and until you don't follow through a lifestyle management, which Ayurveda is about, because Ayurveda is about Dincharya, Ritucharya. So when I saw his ashram, almost like, I won't call it hospital, it is almost like ashram he has opened, like he does Panchkarma, everything. And he used to work in R&D Ayurveda, but he teaches like pranayama, yoga, everything, meditation, everything combined in the package. And so the food, everything they serve you in a way, so you get a full way of healing, in a way where you are fully revived, you're transformed. And I think that is how Ayurveda should be, in terms of giving you a lifestyle management and then telling you, okay, now this is the lifestyle you have to follow, or how you have to moderate. So I feel this is very, very important, that I feel missing in many Ayurveda doctors today, unfortunately. But their treatments still work, because I think it's coming from the sages that the treatments are authentic and they work. But since there's no Dincharya education, no life coaching education, so it does not sustain the person for long. So I feel that the empathy of the doctor comes from the fact where they are very diligently following something to the core of Ayurvedic practices. But this is very beautiful, like amount of recipes you've given, they are worth trying. I don't know if anyone else here would be trying here.
So very important thing is, madam, preparation of ahara. That is your foodstuffs. So first, the treatment starts with your ahara.
Yeah.
The what kind of food you are going to have, that kind of health you are going to have.
Yeah.
So first preference is given to ahara.
Yeah, I liked all the things that you shared because I like barley, I like millets, and I'm so happy that these things actually help you heal because, people always say that people are not able to eat grains, but we still eat in India. It is our main, grain-centric diet, but like you said, for us, we keep the grain 1 year stored. We don't consume it right away. And there is a way, and there's also how you cook it. It's not over processing it into a bread, but you cook the grains in a wholesome way and then you eat them the right way, and the preparations you showed. And then again, we have a beautiful culture of herbs that we add to food to help you digest something. Like we always knew that certain foods will not digest, like fiber and everything. To digest, you need spices and everything, the herbs, not the spices, but the herbs. We used to call it aushadhi. So we need those medicinal herbs that we add, like cumin, turmeric, and coriander, and asafoetida, and all these, how they tremendously help in healing. And we use them in different proportions for different types of healing. And that is so much about Ayurveda, how you combine them in different proportions and it can create a medicine for you at home. And this is the beauty of Ayurveda. So it's just very beautiful to know how vast this wisdom is. And this video is gonna be shared on YouTube. So anybody, if you guys want to go through these preparations again, if you missed anything, you don't have to worry. It will be available on YouTube to go over it again, or just you can go forward in time and check those preparations. The simple home preparations, but don't try to do any medical treatments yourself, because medical treatments we are not here to give advice on. We only give the information about it. So if you're interested, you can consult an Ayurveda doctor directly for your own personal consultation. So I think next time we can talk about osteoarthritis and back pain, chronic back pain, Dr. Salunke, in the next webinar.
Yeah. I am no problem, madam. I can prepare it myself.
Okay, that will be wonderful. Is anyone on this right now in this talk interested in recipe classes? Because Dr. Salunke might be able to give us really nice recipes too.
Yeah, I would be sure.
It is Baisete Kalpana, madam. So in that one, there is a preparation called Ahara Kalpana.
Okay.
So it is totally dealing with the preparation of food.
Food, okay.
According to the disease.
So we could have a recipe class according to disease also, what recipes are good. So Melanie, will you be interested to go over recipes for certain diseases? We could have those type of classes.
Yeah, sure. Yeah, that sounds good to me.
Instead of doctor actually preparing all the recipes, they can share a couple of recipes like Dr. Salunke shared today that are helpful for a particular disease condition. And it gives some people some sort of take-home thing to take for, particular diseases, what they can eat, what they cannot eat. That would be a good one. Thimali, do you think you'll be interested in that?
Yes, of course.
That's wonderful. So I think we had a very nice presentation, and I'm very happy, Dr. Salunke, that you came today and you gave us a full, very comprehensive talk on rheumatoid arthritis. And I look forward to having you again. People don't have a question.
Yeah.
So
No problem.
because you presented so much and so well. So that usually what happens, that when, when somebody presents for so long, people usually are speechless at the end. So we will have another one soon. And we'll probably try to have some recipe classes on too for certain diseases, where you can share a couple of recipes for that type of disease. And that would be very helpful. So thank you for being here. Thank you, Melanie. Thank you, Thimali. And thank you to people who already left us too. But it was a wonderful time here with Dr. Salunke learning about rheumatoid arthritis.
It's my pleasure.
Thank you. We look forward to seeing you again, and
Yeah.
I will now stop the recording. So thank you everyone for being here with us on Karnamai Holistic.